So essentially a hernia is an opening or a defect in the muscle layer that either is not supposed to be there, or it's supposed to be there, but the opening is larger than it should be. And when that happens, that opening in the muscle layer will allow things that are inside your abdominal cavity to come through that opening, and that's typically what causes symptoms. Lots of different types of hernias. We typically name them based on their location in the abdominal wall. So a fairly common type of hernia would be an umbilical hernia, which is going to be right at your belly button. Lots of people are actually born with umbilical hernias. If they're small, and they tend to close, so by the time you're in kindergarten, if you had a belly button hernia when you were born, if it hasn't closed, then perhaps we might fix it. A lot of people will develop belly button hernias over time, so pregnancy can kind of stress out that area of the abdominal wall. Another common type of hernia is going to be in your groin, or an inguinal hernia. Those are more common in men, but women can get them as well. So it's just a natural kind of weak area that we have in our abdominal wall, and so you can develop a hernia there. The other most common type is going to be what we call an incisional hernia. So if you've had a surgery before with an incision where someone has gone into your abdominal cavity and we close that muscle layer up with sutures, if it doesn't heal fully, then you can get a hernia there. And that could be just wherever you've had an incision. So those are the most common types. Most of the time, people will have some discomfort or some pain associated with their surgery or with their hernia, and that leads them to seek medical attention. Occasionally, we can have some cosmetic issues, especially if the hernia is a little bit larger and you're wearing kind of tighter fitting clothing. Sometimes those hernias can be visible, and it bothers people, and they want to have it fixed for that reason. So hernias are very common. Lots of people have hernias. I have a hernia in my belly button. I've had it for years. It doesn't bother me, so I haven't gotten it fixed. But if it bothers you and it's uncomfortable, come in and talk to us, and we'll talk you through your options. Essentially, there's two treatment options if we're talking about surgery. So there's obviously what we call watchful waiting, where we just decide to keep an eye on it if it's not bothering you, or if it's not considered dangerous. For surgical treatment, we can repair hernias, what we call a primary repair with suture or stitches. Typically that's going to be for very small hernias where the opening's about smaller than a quarter typically. And then there's a repair where we put a mesh in. So that's usually going to be a lightweight, permanent, flexible mesh that's either sandwiched in between like a muscle layer and a fatty tissue layer, or inside the abdominal cavity up against the muscle layer. And we can put those meshes in either with an open surgery, where we actually make an incision on your abdominal wall wherever that hernia is located, or with a laparoscopic surgery where we're making small incisions and we're going in with a camera and instruments to repair that hernia laparoscopically. Every once in a while, people will have a surgical emergency related to a hernia, and those are not frequent, but they're common enough. And a lot of times it's people that have had that hernia for years and it hasn't bothered them, and then suddenly one day they're like, oh, this hurts really bad today, this feels different than usual. So the most dangerous thing that can happen, again, with that opening in the muscle, is a piece of intestine can go into that opening. If it gets trapped in there and it can't get pushed back in, then it could start to lose its blood supply, and then that could lead to a situation where you have an intestine that dies, and that is obviously not good, so super dangerous. Most of the time we'll recommend that if you think you have a hernia, or your primary care doctor confirms that you have one or is suspicious of one, it's a good idea to go and talk to a surgeon about your hernia. Do we recommend that it needs to be treated right away? Do we recommend that it can be watched? What are your options for surgical repair? And then you can make a decision together with the surgeon about timing of surgery, if you need it, if you don't.